Now, to take a closer look at how smoking rates are rising in many parts of the developing world, we're joined by Dr. Neil Schlueger. He is the Chief Scientific Officer of the World Lung Foundation. Doctor, thank you very much for being with us on the program.
Thank you.
Which countries have the highest rate of smoking?
The 5 countries with the highest rate of smoking in the world are China, India, Russia, Bangladesh, and Indonesia. And the rates of smoking in these countries are really astronomical. So in China, for example, 60% of men smoke. There are 350 million smokers in China alone, greater than the entire population of the United States. In India, there are 230 million smokers. By comparison, in a country like the U.S., only about 20% of the population smokes. So those 5 countries probably come close to something like 1 billion smokers.
And no coincidence that they're all developing countries.
That's right. These are countries where the market is enormous because of the size of the population, and there is relatively much less government regulation on the sale of tobacco, the use of tobacco, the price of tobacco, and for all those reasons, they're very fertile grounds for tobacco companies to sell their wares.
Why aren't governments in these countries doing more to regulate tobacco companies?
Well, I think that tobacco companies, first of all, are extremely sophisticated in getting their products into developing markets, and they do this in a number of ways, directly and indirectly. They realize that as countries develop in those early stages, they tend not to have much regulation, and they insinuate themselves into the economic life of the country in a variety of ways. So they sponsor sporting events or cultural festivals and really make themselves important to the economy in many ways, and so it becomes difficult to displace them.
But knowing that, knowing most of these governments around the world must realize the public health risks that are involved in smoking, and they still find it very difficult against all of these economic pressures to say no or to bring in better legislation?
Right, so it's a very good point. And I think what's happening now, and the reason there's some reason for optimism, is that these countries realize that ultimately it's in their enlightened self-interest to have healthier populations, because as much as they might benefit a little bit in the very short term from the money that tobacco generates, over the long term, the amount of money they'll have to spend on taking care of people who are sick from tobacco far outweighs that.
And I guess they're up against these problems when you have many countries in the world where cigarettes sell for less than $1 a pack. Is that also a big reason why these countries have so many smokers and it becomes difficult to control the problem?
Absolutely right. Smoking is very inexpensive in many countries in the world, and price is one of, I think, 3 major areas where governments can really make a difference. 3 things that need to be done, that can be done and are effective, are raise the price of cigarettes, tax them heavily, as has been done in New York, for example, where cigarettes are more than $9 a pack, pass laws that restrict smoking in public places, that restrict sale of cigarettes to young people, and enforce those laws. And then the third component, educate the public about the dangers of tobacco. Those are things that governments can do that are effective. If you could do one thing, cure tuberculosis, AIDS, malaria, or get rid of cigarettes, getting rid of cigarettes would improve the health of the planet more than anything else you could do.
Okay, Dr. Schlueger, thank you very much for joining us.
My pleasure.